In your health check, new here at 5, Ozempic and similar medications for type 2 diabetes and weight loss showing promise in helping people struggling with addiction, according to recent studies. Researchers published their findings in the journal Addiction and Psychiatry. According to the studies, people addicted to alcohol who also had a prescription for Ozempic or similar GLP-1 medication had a 50% lower rate of binging on alcohol compared to people not on the meds. And people with opioid use disorder taking the medication had a 40% lower rate of opioid overdose. The active ingredients in Ozempic, Mounjaro, and similar meds work by mimicking hormones in the body that help regulate blood sugar and make you feel satisfied after eating. These studies suggest the drugs can curb not only cravings for food, but possibly alcohol and other addictive behaviors. The president of the North Carolina Society for Addiction Medicine says he isn't surprised by the findings.
A lot of the what we would say neuroanatomical structures in the brain, so just different parts of the brain, are all very closely clustered together that are involved in substance use disorders, kind of overeating. A lot of that dopamine, that's the main neurotransmitter in the brain, that is the thing in our reward center that gets really overactivated. And so it's not surprising that, because there's a lot of overlap in a lot of these different mechanisms, that this medication would actually work well for this.
That's Dr. Baca Atlas, who says there are only 3 FDA-approved meds for addiction treatment, and much more research is needed into studying GLP-1s for it. Several clinical trials are underway to study how the medications affect addiction.